Hey guys, welcome back to my channel. As promised, I did tell you guys that I wanted to respond to a question that I often get from both families, um, friends, coworkers, um, and even strangers often will ask me, "Hey, Olinda, why didn't you go to medical school as opposed to NP school?" And I know that some of you guys might also think about the same question, so I wanted to answer it. And I'm trying to do this video really quick because it's like 2 in the morning, and I'm tired, like you can see it. Um, so let's dig into it. So reason one, well, before that, maybe I should give you guys a little background information as to what happened. I did, when I came here in 2009, I spent about 2 years in high school, and then I went to college. I did go to Oriental State University, and I got my bachelor degree in biology with pre-med. Um, I wanted to go to medical school, but after graduation in 2015, it's when I was learning about everything that it required, as far as you needed to get a specific amount um, of clinical hours or so, and you needed to take the MCAT, which I never studied for. Apparently you're supposed to be preparing for the MCAT since your third year, in college at least. I didn't even know about that. And in 2015, they actually changed the MCAT to add biochemistry, which I never took when I was in college. So it wasn't a requirement for pre-med. So I wasn't required to take it. And it was just too much for me to prepare for. It would have taken at least a whole year of preparation, including taking these MCAT course before I could take the MCAT. And I realized that I could, hey, I could get my nursing degree in 15 months, since I already have all of the prereq. So I went ahead and I applied, and I actually never looked back. So since then, I realized that there are a lot of things that nurse practitioners can do, doctors can do, that nurse practitioners can do. And what I wanted is to be able to assess my patients, and order tests, and diagnose my patients, and evaluate my patient correctly, manage the treatments, and including prescribing medications and all of that. And nurse practitioners can do all of that. The only things that nurse practitioners are not able to do, we are not able to do surgeries. And depending on which specialty that you choose as an NP, you might be required to take a few extra training, extra classes to to be able to do minor surgeries. But usually the MDs do, MDs, they do surgeries, surgeons and things like that. So, and the other thing is, if you are interested in radiology, NPs can read x-rays and imaging, but usually the MDs are the expert when it comes to radiology. So reason why I wanted to become an NP versus going back for medical school is the work-life balance. So nurse practitioners are generally they enjoy a better work-life balance than doctors, due to more schedule flexibility, lighter on-call requirements, and the ability to set their own hours. Which for MDs, they do have a more rigid schedules, and due to billing needs and then student death. guys, be nice to me, because this is kind of like, this is new to me, so I'm still learning. Be nice to me. So anyway, reason two why I decided to go for NP school as opposed to medical school is the length and cost of education. Medical school is like a 4-year program, where, like, like NPs is 1 to 3, depending on if you decide to go full time versus part time. And one big thing for me, especially like as an immigrant, I definitely did not want to graduate school like with a high student loans. And even right now, if I knew what I know right now as an NP student, I would have made like better choices. And For example, excuse me, for example, I will just go straight to like a community college, spend 2 years. I will come like with another video for immigrants or for anyone who want to do like nursing, and tell you exactly like what you can do to decrease the amount of money you will spend and have hospitals pay for your school, as opposed to you doing all of that. So let's get back into my reasons for going to NP school. Versus like versus MD school. So we do have less requirements as far as it concerns like 4 years. It's like a 1 to 3 years of a nursing of NP program, and then the course, like I said, it's very, very, very different than what like someone will pay to go through medical school. So that was like a very big uh, component for me, I will say, because as an immigrant, we do live, and I'm speaking like in a general way when I say that, we do live like our parents back home, friends and families that are like counting on us. I'm not saying that immigrants do not go to medical school, depending, but for someone like me, who had a lot of people that I wanted like to support financially, I needed something like going to NP school that will allow me to work my full-time job as an RN, so I can financially support my family while still like going to school. And it would have been extremely hard for me. I have never been to medical school, so I don't know the requirements, but I'm pretty sure they do have enough that they do not hold like a full-time job while going through the specific program. So the other reason why I wanted to become an NP as opposed like to like an NMD is like NPs, we do focus on preventive care, and that's like a big thing for me. I always believe that if I can prevent my patient from having diabetes, it's better than like treating diabetes. If I can advocate for my patient too, with being like a nurse, like one thing that they do teach you is they do teach you to have like a very strong advocacy. So I do enjoy like being an advocate for my patients, and I feel like as an like the doctors, they do advocate for their patients as well, but really like a major benefit of being an NP is like actually knowing the patient, knowing, like being there with them, and educate them. Education is, we are very big, so those are the things that I believe on. Preventive care, like education, all of that, I do believe that if we can better educate our patients, then there are a lot of diseases like they can avoid, a lot of things that they can do for themselves. So the other reason why I feel like being like an NP is better for me than like going back like for medical school is like there is an increased job. There are like increased job opportunities and higher satisfaction. Although like many like current MPs, I'm pretty sure they will disagree with me. But for me, I feel like there are a lot of things you could do. Like as an MP, you are not set to one thing. If you decide, after 2 years of doing cardiology, you want to go for like, let's say like to be like to go like for women's health. It's easier for like MPs to change that, and we know like with something like the COVID time, like a lot of the NPs actually quit their jobs like to go back and work like as an RN, and they were like making 10K, 15K a week as a nurse during like COVID time. So this is the flexibility that I'm looking for, and for like a medical doctor, like it will be very, very hard. And the other like reasons, like minor reasons, I feel like it's like less risk for burnt out as an NP, and you can change things around that an MD wouldn't be able to do. And let's be real, you can even open your own practice in 27 states in America. Let NP practice fully, like independently. So a lot of the things that MDs can do, I can do them as an NP. So for me, it's really about taking care of the patients. And if I can learn something that will cost me less money, and I will do less school while still, giving the same care to my patients, why not? So, if you do have something that you will want me to talk about, drop them in the comments, and then keep following for more contents.